I wasn't supposed to present to you in this conference at all, but one day I walked into the office of Dr. Huda, as usual every morning, that I have to walk into her office to say hello. And she said to me, you're going to present a topic called Tachypsychia. I didn't know what Tachypsychia is about. I thought it's a Japanese dish or a Chinese noodles or something. And then I went to the usual Bible, it's called Wikipedia, Google, and I typed Tachypsychia. And it's apparently something in martial art, but it's got a medical definition. So I said to myself, how can I talk about something that I don't know anything about? Well, it's very easy, you know. It's one of the things. I just tell you a story. And when I was a medical student, my doctor asked me to present in front of a camera about something that I don't know anything about. And I had to present about the camera itself that was in front of me because that's the only thing I had to think of. So I said to myself, probably I could do the same thing with you guys. I talk about something that you don't know anything about and I don't know anything about, and you're going to be so convinced that it's the right thing. But anyway, so I went and started to think, I'm going to do something that is going to be the introduction to a semi-education, which is simulation education. So let me just define tachypsychia for you. Tachypsychia is basically a neurological condition where the time perception is altered. Sometimes you're doing something and you find yourself, you spend so much time, but it's like a second. And some other times, you'll be standing there waiting for an event to happen, and the minute appears like an hour. That is the definition. But when it comes to with a neurological disorder, it becomes a disease. One of the factors that affect perception of time is stress. So I said to myself, instead of talking about tachypsychia, I'll talk about how do we behave if we were subjected to stress. Okay, so the thing that I'm going to present to you is something I learned. And how did I learn it? I learned it the hard way. This is how I learned it. I did a lot of mistakes. And that's how I learned. I wish I read about tachypsychia and about stress before I learned these things. But unfortunately, I did learn it the hard way. So I'll start with an incident that happened to me. About 2 months ago, I had an interview in Kuwait TV where I was supposed to talk about pain management. And as usual, I was so relaxed. I went there. They called me and they said, your interview is going to be at 5 o'clock, but I had a case at 7 o'clock. I wasn't bothered at all. It was an interventional pain case at 7 o'clock. I said I'll go at 5 o'clock, I finish the interview, and then I go to the case itself. I was so relaxed, happy, not thinking about my case after that at all. Not even crossing my mind. All I thought about is that I hope the hospital don't call me to come and do the case, so they don't interfere the interview. But you switch your phone off when you're on TV. So I finished, and it was a 50-year-old female, ASA2, diabetic and hypertensive. She was coming for a cervical facet block. For people who don't know, the facet is basically a joint that is between two vertebrae, and there is a sensory nerve, and we block that nerve in pain management when they have a problem with that joint. And she had posterior headache. She's coming to my clinic walking without any problems. And she's just complaining of the headache. And she had the classical presentation of C3 irritation. It's a very small nerve that crosses the articular process. And I said, it's a piece of cake. I'm doing this every day in Adan Hospital. I'm doing this every day in my private practice. It's the usual stuff. That's the block. You put dye. It's in the articular process. It's outside the epidural space without any problem. But she started to say, Doctor, my lips are funny. And I'm standing there. This is a normal subject who's lying on the bed, walking with her daughter and saying, my lips are funny. After injecting 1 cc of dye and 2 cc of local anesthetic. And then she started to say, I do not feel well. Something is wrong. And her eyes start to roll backwards and she started to shut her eyes. So at that stage, her heart rate was 70. It went up to 150. And the blood pressure, I said to the nurse, I don't usually check the blood pressure because it's so quick. A procedure was so quick. I don't measure the blood pressure. So I asked the nurse, check the blood pressure for me, and it was 60. And I kept saying, wake up, wake up, wake up. She's not responding to me. And she was making funny noises. This is not her picture. This is a picture that I got from the internet. This is how she looked, basically. Her lips started to swell up. Her eyes started to become puffier. And she had a rash at the site of injection of the antibiotic. She had an antibiotic that was given while I was doing the procedure, and she had a rash across that arm. And they finished the whole antibiotic. So I said to myself, drill, anaphylaxis drill. I know this very well. I did that in the exam. I was reading it for my board exam. I was reading it for my fellowship. I know this very well. So let me go through the drill. But at the same time, this is what was going through my mind. Now, I have an untrained team around me. They don't know what's happening. They just realized that I am panicking, but they don't know what's happening. The nurses are not aware that the patient at this stage is really sick. I called for help. The other doctor was busy with a cesarean section on another floor. So they said, unfortunately, we cannot reach the other doctor. He's busy with a cesarean section on another floor. And I said to myself, good, that's all I wanted now. Now the third thing, she was beta blocked. So I'm thinking, if I give this woman adrenaline, is she going to respond? Is she going to get her pressure up? What am I going to do? All this is going through my mind. Should I intubate her? You saw how her face was. She was swollen up. And I'm thinking, is this going to get worse and I won't be able to intubate her? Should I intubate her now? Is she going to be a difficult intubation? And what medication would I use? She's already hypotensive. What if I give her the wrong medication? What if she drops her blood pressure more? What if I give her? I called for ketamine. There is no ketamine there in the hospital. All they have is propofol. All they have is propofol. Would I give her propofol and kill her? I don't know. I was so confused myself, and I'm looking around myself. And if you look at me, you will see that I'm panicking, but it's like being in a circle, going around yourself, turning around yourself, not knowing what to do. And I'm thinking, what about if things happen in a bad way? What will I do? And I kept praying and praying that nothing could happen. What if we have to do a tracheostomy? What am I going to do? So many things that came into my mind at that stage, and I didn't know what to do. So I said to myself, let's go and let me recollect my thoughts and do what I can do at that stage. Believe me, in that situation, and I don't know if you were in that situation, but the nurses are running around and hitting each other, not knowing what to do. You'll say atropine, for example. You'll see 5 nurses going for atropine, leaving the patient. It's a chaotic situation. So, I recollected my thoughts, and this is what I did. I said to myself, I want to be focused. I want to do the right thing. So I took a deep breath in. I recollected all my thoughts, and I went through the anaphylactic drill step by step. I gave her 100% oxygen. I started communicating with the nurses on a basic level. You give fluid. You stay next to the medications. I want epinephrine. The technician, I said, do not touch the patient. You just get the drugs to the nurses. And I orchestrated the whole team on a basic level. I wish this works faster. So I gave all the medications, and then I was continuously praying, please God, stop me from harming this woman. Please. Honestly, that's what I was doing. I said, stop me from harming this woman, because I might do the wrong thing at that stage. And one thing that was going through my mind, what am I going to say to the family after this? So, let's talk about response to stress. This is the fascinating part about we as humans. So there are two types of stress. There's the psychological stress, which is a difficulty in performing a task. And there is the cognitive stress, which is a difficulty in making a decision. And whenever we're faced with a stressful situation, we go through the combination of stress, the psychological and the cognitive part. And the response to stress, we either fight or flight, or what do we do most of the time? We freeze. We don't know what to do. And if we freeze, the end result is probably catastrophic. And we all know from physiology, probably, there are so many hormones and neurotransmitters that are released in response to stress, and they have a role in your performance, and that's what we're going to talk about. It's very important that we know that the hormonal system is so much switched on in a stressful situation, and that's very important for your performance. There is a law that's called the Dotson Law, and what it talks about is that if you are about to give anesthesia to somebody, and you're used to a routine way of giving anesthesia to somebody, and then something stressful happens to you, like this. The head of department walks into that operating room. You start to have problems with conducting the usual way of anesthetic. And you might do a lot of mistakes that you wouldn't do usually. And it was found that whenever you are stressed, you either go through two phenomena. One, you can be so scattered in your thoughts, and you switch into a default type of behavior, or you can be over-focused on something and you might overdo it. So, and they found also in animal studies, like the pipefish usually likes to mate with a large fish when it's the mating season. But if there was a predator around, they will go and mate with any fish. So it is a default situation that they go following in a stressful situation. The other thing that also they found, that if you are so trained in your brain to over-focus on something, you can so much direct your thought into such a tunneled vision, which might result in the wrong decision, which we're going to talk about later on. So to decide, to decide, it's a balance between the two. I have to skip through very quickly, because it's... And to get into the memory part, after a stressful situation, to have this memory built in your brain, it's the decision between the two. So if your default system is active, your memory is probably very strong. But if you're over-focused, that might not be the situation and might not stick in. And there's a lot of things that enhances the memory and reduces it. So this is the curve. And you can see performance or stress against performance. So in the red, you're sitting, you're relaxing. That's when I was doing the interview. And I have a low heart rate. I'm not alert. I'm sleeping, actually, in that interview. And then you move up and you get into the yellow range. And what happens? You get your best performance and your fine motor task becomes better. Okay? And then after that, you get into the green zone. And in the green zone, what happens is that your heart rate increases and you lose your fine motor skill. And remember this, you see it all the time. When you want to put a central line, or for cardiologists, when they want to do a cath, and they want to slide the guide wire over the catheter, how many times you miss it? You lose the fine motor skill, but the gross motor skill is still there. So that's you're in the green zone in your performance. And then you move into the gray zone where your cognitive problem, where your cognitive function becomes slow, and you start to have an over-focus and possibility difficulties in making a decision. And after that, you get into the red zone again, and that's where you don't want to be, which is the freeze type of behavior. So what I learned that I might not taken the right decision when I didn't intubate that woman. I tell you the truth. I was saved by somebody called God in that situation. I should have had intubated that patient. If you go through the drill, you would have gone through intubation of that. But I didn't intubate that patient. You know why? Because of my mental map. If you have, for example, a book that of a color, blue color, and you know that book of blue color responds to the ICU book, and you want to look for it in your room and you put it somewhere. You go around looking for a blue colored book. But if you have it in your mental map that book is red, you can spend all day looking for that book and you wouldn't find it. And that's what I had in my mental brain. I didn't want to accept the fact that I had to intubate this. I was going around in my mental brain how to avoid intubation rather than to go and intubate that patient. And that's the same situation again. It's very difficult to take that decision and do the intubation. So who are the people who do not make the correct decision in these situations? You'll be surprised. Okay? Those people who do not update their mental map, those people who do not have the other options in their mental map of dealing with a situation. And not only those people, they are not present or aware of a situation. If you've never been in an anaphylaxis, you're not aware of it. Or if you haven't been told about anaphylaxis, you're not aware of it. And if you've never been in it, you don't know how it looks like. And not only that, most experienced doctors, you'll be surprised. You know why most experienced doctors? All of you do anesthesia. You walk into the room, what do you have in your mind? You're going to give propofol, you're going to put a mask, you're going to put propofol, fentanyl, rocuronium, intubate, talk with the surgeon, play with your WhatsApp, send a little bit of tweets, wake up, give reversal, and that's it. That's your experience every day for the last 30 years. You've never been into a situation where you have problems. And if you run into problem, then that's when you fall. Unlike somebody who's still updating his mental map all the time. Okay? So what do we need to do to avoid catastrophe? Have a simple updated mental map, re-evaluate the situation, and think out loud. And that's what I did only one thing, which is I thought out loud in front of the nurses with that situation. And again, remember, in this situation, your frontal part of the brain is not controlling your actions. So your actions are independent of your frontal part, which tells you what is the right thing and what is the wrong thing. So the chances of doing the wrong thing is very high compared to doing the right thing. I did the wrong thing, and I managed to get away with it, by the way. I could have done the right thing and not get away with it. But it's good that I did the wrong thing and got away with it. Okay? So, where do I want to be in a stressful situation? I want to be in that green part. And we can play with this curve. I can make it higher and I can make it wider. And how do I do that? It's by a process called stress inoculation or desensitization. Desensitize yourself with stress. So how do you do stress inoculation? You need preparation and you need reaction. Two things that you need to do. In preparation, you need education, rehearsal, and application. Now, education is what we get through our board, and knowledge, that's in the textbook. And you need to have a simple algorithm. The rehearsal is what we're going to spend the rest of the night talking about and going through, which is a simulation. And you need a mental rehearsal. Even if you're sitting next to a patient that's going so smooth, go through your mental map and try to update it by going through a difficult situation. I'm going to give epinephrine, I'm going to do this, I'm going to do this, I'm going to do this, I'm going to intubate, I'm going to do a tracheostomy, I'll do a midline incision, go through. And that has been shown in research, it has almost the same effect as if you're doing simulation. So have your mental rehearsal. Application, Again, when you see this patient, don't do like what I do. I'll say to Dr. Ahmed Ali, go and intubate this patient or do this case. You go yourself and take the challenge. Put yourself in that stressful situation. Go through the difficult intubation. Go through the difficult circumstances. And the reaction, take a deep breath, make sure that you're calm and relaxed, and you want to get yourself to the peak of the performance, and talk loudly. This is what my daughter tells me when I speak to her and she doesn't like what I say. Talk to the hand, and she walks away. Okay? And think loudly, and don't do this. Thank you.